Healthy Living in the Four Corners is brought to you by San Juan Regional Medical Center. Do you suffer from pain, stiffness, or swelling in your knees, hips, or shoulders? You could be one of 30 million people in the United States who suffers from osteoarthritis, a painful condition that arises from the loss of cartilage in the joints, causing swelling in the surrounding tissue. Osteoarthritis was once believed to be caused by joints wearing down over time. But according to the Arthritis Foundation, scientists now consider osteoarthritis to be a disease. Contributing factors include aging, an old joint injury, or repetitive high-impact activities like running or skiing, weak muscles, obesity, or a family history of osteoarthritis.
Prevention usually comes in the form of healthy lifestyle choices such as proper nutrition, managing body weight, regular physical activity, stretching, balance exercises. Those are the more general ways to help prevent osteoarthritis.
Casey recommends a multi-pronged approach to treat the pain and stiffness associated with arthritis. Try hot and cold compresses to loosen tight joints and reduce inflammation. Analgesics like acetaminophen or non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, or naproxen also can reduce inflammation and pain. Other treatments include corticosteroids taken orally or injected directly into the joints, or injections of hyaluronic acid, platelet-rich plasma, and other drugs to lubricate the joints. And finally, you can have your joints replaced. But to avoid surgery for as long as possible, Casey recommends exercise and movement, and that's when physical therapy can help, especially if your pain and stiffness are interfering with your activities.
First thing is we try to identify what their impairments are. We try to figure out, okay, how is this arthritis limiting your quality of life and your daily function? You know, is this stopping you from skiing? Is this stopping you from hiking? Is this stopping you from, doing the things you enjoy, spending time with your family, or getting up from a chair or getting down on the floor?
Casey addresses balance, flexibility, and strength with his physical therapy clients who suffer from arthritis.
One of the things that I think is one of the best treatments that you can do is non-weight bearing, low impact exercise. So your stationary bike or bicycling is a great treatment or a great intervention for treating osteoarthritis. But again, the intensity, the duration of that activity can vary depending on the skill level of the individual and what their objective is. Another option is warm water exercise, such as water aerobics or water therapy. That's another thing we do offer here at San Juan Regional. Is we have one of the only warm water therapy pools in the Four Corners area, which is a nice treatment for osteoarthritis. The muscles are very key to helping offload the joints, and so we spend a lot of time working on balancing muscles around joints, whether it's the knee, the hip, the back, the ankle, the thumb, or shoulder. So we spend a lot of time looking at where the weaknesses lie within that particular joint and try to address the weakness and the impaired movement that comes from that weakness.
If you're just beginning to feel the pain and stiffness of arthritis, remember, just keep stretching and moving. And if you'd like to know more about reducing joint pain, attend a free presentation on osteoarthritis featuring orthopedic surgeons and physical therapists. The presentation will be on Wednesday, January 22nd at the Farmington Public Library. The event starts at 5:30 p.m. with light appetizers. A panel discussion follows at 6 p.m. To reserve a seat, call 505-609-6078 or go online at sanjuanregional.com/CREG. I'm Deborah Urota for Healthy Living on the Local News Network.